Good morning. Thank you so much, Professor Almeida. It's a real honor to be presenting this result. We are going to comment this afternoon in the Presidential Symposium about our results on efficacy and safety of ARI0002H, that is an academic BCMA-directed CAR-T cells for patients with refractory relapsed myeloma. I'm Carlos Fernandez de Larrea from Hospital Clinic in Barcelona. I am here on behalf of all the Spanish researchers in this project. Here you can see my conflicts of interest. We have developed our own CAR-T against BCMA, the most targeted antigen in this disease for immunotherapy, that is called ARI0002H. Is a CAR-T that has been humanized and directed against BCMA with a 4-1BB as co-stimulatory molecule. After our results in vivo and in vitro, we decided to explore in a clinical trials with the primary aims to explore the safety, with the rate of immunological in terms of cytokine release syndrome and neurological complications, as well as efficacy in terms of overall response in this population of patients with refractory myeloma. Thus, we know that they don't have, even the prognosis has improved significantly in the last year, they don't have a clear standard of care and they have a poor survival. We conducted this research in 5 centers in Spain. We coordinated and produced the viral vector in Barcelona. CAR-T cells were produced in 2 facilities, in Pamplona and in Barcelona. And together, all the 5 centers recruited the patients, performed the apheresis, and treated locally their patient. That was one of our main objectives, to treat the patient the closer possible to their homes. The patients were with a median 4 previous line of treatment. They were all younger than 75 years old. And one of the particular ideas, after we have learned in our previous CAR-T for CD19 malignancy, this is approved for exceptional use in Spain, ARI-1, it was to fractionate the first dose of 3 million of CAR-T cell in three bags, and a second dose, that is the completely new, a second dose of other 3 million of CAR-T cells after at least 4 months of the first infusion in patients with some degree of response and non-limiting toxicity. The main result is here. All the patients showed some degree of response. That means at least partial response. 63% of the patients achieved a complete remission, and 93% a very good partial response or better. That was associated with a 96 and 92% of negative minimal residual disease in bone marrow by next generation flow at days 28 and 100. We see in terms of extramedullary disease, we see that also all but 1 patient with plasmacytoma responded to this therapy. We have a median follow-up on 1.5 years. And at that time, 53% of the patients are alive and without progression, and almost 3/4 of the patients are alive after this 18 months. In terms of safety, we see mild CRS, mild immune effects in 90% of the cases, but we didn't see any grade 3 or grade 4 CRS, and we don't have any case of neurotoxicity, acute or late. In conclusion, ARI0002H production is fast and feasible. It's 11 days of our time of production. Patient achieve deep and sustained response with low-grade toxicity. We are also to mention in the afternoon the potential impact of the second dose. We think that this academic humanized CAR-T against BCMA will be a promising therapy for patients with relapsed refractory myeloma. With this kind of academic, I always want to recognize the work of these 5 centers that are participating in Spain and our patients and their families, and to all the team in my institution that consider as a priority the development of these strategies for the treatment of our patients. Thank you.